What you're asking about is severe and persistent mental illnesses, or SPMI. Dr. Brooke here. This is Cook with Dr. Brooke, where we talk about the connection between nutrition and mental health outcomes. So, severe and persistent mental illnesses, SPMI, are a family, a category of mental illnesses where those of us in the field consider schizophrenia to be in that category, bipolar disorders. That is not to mean that depression can't be severe or that ADHD can't be persistent, but they wouldn't fit in this SPMI category. When it comes to SPMI, there are dietary changes that have shown some evidence to help support better mental health outcomes. But in this category specifically, I would say that that is never going to be in lieu of traditional management with psychotherapies, with medications. I would really talk to your doctor about what treatments you're already getting and if those can be optimized. And you can also optimize your diet. What optimizing your diet for something like bipolar disorder looks like is going to depend on kind of where your diet is starting from. But for the most part, all comers would do better to be following a more Mediterranean style diet. The nutrients that I would specifically focus on would be getting more omega-3 fats. Those have been shown to be helpful in psychotic disorders, in bipolar illnesses, also getting more fiber to promote good gut health. We know that in SPMI, often there's some gut dysregulation, and we know that the brain and the gut are really closely connected, so I would be focusing on getting healthy fats in your diet and more fiber. There's also some promising research about using a keto diet in SPMI. Ketogenic diet is basically going to be no or very low carbs to keep your body in ketosis. And we know that this is a treatment that works well for epilepsy, for certain seizure disorders. So it makes sense to me, kind of thinking in my brain about the physiology of everything. It makes sense that this could be used in certain psychiatric conditions because the medications that we use in SPMI often overlap with seizure disorders as well. One example being Depakote or valproic acid. We know that it is a very good mood stabilizer, but it's technically in the category of an anti-epileptic. So that's a medication that is kind of used in both of those conditions. So it kind of makes sense to me that there could be dietary changes that could be used in both of those conditions as well. Keto can be really hard to follow, however, and there are some potential negative consequences of it. So I would not start there unless you've already exhausted other options. Talk about it with your provider. Talk about where your diet is already at. Talk about things that you've tried. Talk about medications that have helped and not helped. Talk about therapies that have helped and not helped and that you could try. And if you're still not making progress, definitely adding those omega-3s, getting more fiber in, and then also keeping keto in the back of your mind is something that you could try if all else fails.